Hi, my name is Sarah Trokey. I'm a family nurse practitioner student at Maryville University. I'm doing my head-to-toe assessment video for my health assessment class. This is Nicole. She's going to be assisting me. Before she came in, we got height and weight, her vital signs. We also did the Snellen distant vision exam and the Rosenbaum near vision exam, and I had her empty her bladder and put on a gown. So first of all, I'm going to be inspecting her head and face. I'm just looking for color, making sure that she's pink and that she doesn't have any visible lesions. Also looking at her moisture, making sure that she's dry to touch. And then looking at her hair to make sure it's evenly distributed, it's not dull or broken in any areas, and that there is no visible baldness. I'm looking at her nails to make sure there's no clubbing or cyanosis or any ridges. And I'm looking at the symmetry of her eyes and ears, making sure that those look appropriate as well. And then that her skull is round and there's no visible protrusions or bulges anywhere. Next, I'm going to assess the cranial nerves. The fifth trigeminal nerve, there are 4 tests that we do to assess that. The first one is to have the patient clench their teeth together, then wrinkle their forehead, close their eyes tight, and puff out the cheeks. And then the 7th cranial nerve is the facial nerve, and with that one we just have the patient smile. Make sure that it's symmetrical on both sides. And then the 12th or hypoglossal cranial nerve, we have them stick out their tongue and then move it from side to side. Okay, next we palpate the scalp and hair. So I want to make sure that the scalp is freely movable. I'm not feeling any nodules or masses or anything like that there. And also feeling the hair for its texture, making sure that it's soft, and that's all appropriate with her as well. And then I'm assessing the temporal pulses and then the temporal mandibular joint. So just say ah. Okay, making sure that there's no cracks or crepitus there. And then palpating the frontal and maxillary sinuses for any fluid buildup or tenderness. Okay, now I'm going to have you close your eyes. We're going to do a sensation test. So I am going to touch you with an object. It'll either be soft or sharp, and let me know if it's soft or sharp and where I'm touching you.
Soft forehead, sharp cheek, soft chin.
Next, I'm going to inspect the eyes. So I'm just looking at them to make sure that they're symmetrical, they're in the correct position and alignment. I'm not noting any tremors, and I don't see any lesions or discolorations to the eyelids. Also looking at the eyelashes, making sure that they're pointed outward, and that the sclera are both white, and that the conjunctiva is a pale pink without any signs of discharge or erythema. I'm going to then palpate the lacrimal apparatus, make sure that there's no discharge there. So along with the eyes, we want to assess for pupillary response. We do that with the light reflex. So I'm going to check to make sure that they constrict and accommodate. So just look against the wall there. I'm looking for a direct response and a consensual response from that eye. And then again, a direct response and a consensual response. And those are good. So next we're going to do the 12 cardinal fields of gaze. And these assess the cranial nerves 3, 4, and 6. So just with your eyes, without moving your head, follow my finger. Good. I'm looking for any jerking eye movements there, and she didn't have any. So next I'm just going to look at the ears again to make sure that they're symmetrical on both sides. They're the appropriate color as the rest of her body. There's no visible lesions, deformities, or nodules present. And also that the auricles are in line with the inner canthus, and hers are. So then we palpate for any tenderness, and again, feeling for any nodules. We're also going to palpate the mastoid bone at that point too. And then we use our otoscope and look inside the ears at the canals in the tympanic membrane, and looking to make sure that they're pearly gray and that there is a light reflux present. Next we're going to do a whisper test. So I'm going to come behind you and I'm going to whisper a word on both sides. Just tell me which word I'm saying.
Apple. Orange.
Okay. The next two tests are for bone conduction and air conduction for hearing. The first one's called the Weber test. I'm going to strike this tuning fork and put it up on your skull and tell me if you can hear it in your left ear, your right ear, or both ears.
Both.
And then the Renee test, it checks bone and air conduction. And so I'm going to put this on your mastoid bone, and I want you to tell me when you stop hearing it, and then I'll put it by your ear and tell me when you stop hearing it there too.
Okay. Okay.
Okay. And it should be a 2-to-1 ratio, air longer than bone. Okay, next I'm just going to look at the nose, make sure that it's midline and that there's no obvious deviations. And then I'm going to palpate the bridge as well as the soft tissues, make sure that it's firm with no crepitus present. Then next I'm going to assess the patency of the nose of each nair. So I'm going to occlude a nair and have her breathe, and then occlude the other nair and have her breathe. Make sure that she breathes the same out of both. And then when looking at the nasal mucosa, we want to look at the color, if there's any discharge present, make sure that there's no masses or swelling, and that the septum is not deviated. And everything looks good there too. So looking at the mouth, we're going to first look at the lips. Make sure that they're an even color, there's no dryness or breaks, discolorations, or lesions present to the outside. And then looking inside the mouth, we're going to assess the gums and teeth, make sure there's no dental caries, make sure there's no signs of gingivitis. Also look at the hard and soft palates, and the floor of the mouth too. I'm just going to do a visual inspection. Everything looks good. And then we want to, with the tongue blade, observe the tonsils, make sure that they're not swollen or don't have any drainage. We want to check that the uvula is midline, there's no deviation there, and also make sure that she has an appropriate gag reflex, which assesses cranial nerves 9 and 10. And everything looks good. Okay, so moving on, I'm going to look at the neck, just inspect it anteriorly as well as posteriorly. You just want to make sure that it's symmetrical, even, that it looks like it's midline. Also want to look at the sternocleidomastoid muscles as well as the trapezius muscles, and look at the visual inspection of the trachea. Make sure that it looks like it's midline also, that there's no visible signs of jugular vein distension, and then we'll do some range of motion with the neck. So if you would just look down and look up, look over, and over, and then touch your shoulder, your other shoulder. Okay, and then would you shrug your shoulders? Okay. And then we move on to palpation of the neck. So we'll first palpate the carotid pulses, and we only want to do one side at a time with those. Make sure that there's no heaves or thrills. And then palpate the tracheal position. Make sure that it's midline with no deviations. And if you would just kind of turn to the right and swallow. I'm checking her thyroid to make sure there's no masses or nodules there. And we'll go on to checking the lymph nodes. So I'm checking the occipital, the post-auricular, pre-auricular, retropharyngeal, submandibular, submental, the anterior and posterior cervical chain, the deep cervical, and the supraclavicular. And then also we'll check the axillary nodes. So we'll go under here, under both axilla, the epitrochlear nodes, and the infraclavicular nodes. And all those feel good. And while I'm here with the bell of my stethoscope, I'm just going to listen to the carotid to make sure there's no bruit there. And then also the thyroid. Okay. So for the musculoskeletal part of the assessment, we want to look at the upper extremities first and look at the hands. Make sure that the capillary refill time is less than 3 seconds, the color and temperature of her hands is appropriate, and that there's no clubbing or cyanosis. We want to check the brachial pulses on both sides, and then also the radial pulses on both sides, and those are good. With her arms and shoulders, just looking at the skin color, making sure neither one of her shoulders drop on either side. The muscle mass looks good. Also want to check a little bit of her upper body strength. So lift your arms up like that for me. I'm going to try to push them down, but don't let me. Okay. And then I'm going to try to push them up. Good. And then if you would just put your arms like this, and then do this, and then flex your elbows. Good. Okay. So doing some rapid rhythmic alternating movements, we have the patient pat their knees, go back and forth as fast as they can. And that not only assesses the musculoskeletal upper extremities, but it also assesses some neurological function as well. And then the fine motor movements we use for proprioception and cerebellar function. I'll have you do this with your fingers. And then I'll have you put your arms out, touch your nose with one, and then touch your nose with the other. Okay. And then I'm also going to have you touch your nose and then touch my finger. Okay. Good job. So moving on, we're going to assess the respiratory system. So I'm going to go to the posterior chest first. And all I'm doing right now is just inspecting the chest, and I'm looking at her respiratory rate, making sure that it's even and non-labor. Doesn't look like she's using any accessory muscles or anything like that. I also want to make sure that the anterior-posterior dimension is less than the lateral dimension of the chest. So then we're going to palpate. I'm palpating the muscles as well as the skeleton. And I'm just looking for any tenderness or pulsations in the back. I'm going to check the diaphragmatic expansion. So I'm going to put both my hands around the 10th ribs, and I'm going to have her take a big deep breath in and out. And note that both of my hands rise symmetrically on both sides. And then with tactile firmitus, I'm going to place my hands on her and have her say 99 as I move my hands down. I'm going to feel for symmetrical vibrations. So say 99.
99, 99, 99, 99, 99.
Okay. Then I'm going to percuss the back. So we're going to do the costovertebral angles for tenderness. This is a sign of kidney infection or disorder. So just let me know if you're tender or not.
No tenderness.
Okay. And then I'm going to go ahead and percuss for resonance. So we're looking for any dullness or hyperresonance. And everything looks good there. So with diaphragmatic excursion, that's another test. We're going to kind of see where the diaphragm is when it's completely at rest and also when it's completely constricted. So you take a big deep breath in and completely let it out and then hold it. Okay, and I'm going to mark the spot there that I feel. And then if you'll take a big deep breath in and hold it. When I feel the dullness, I'll mark those two spots. They're usually between 3 and 6 centimeters. Next, I'm going to auscultate the posterior chest. I'm going to go from side to side, listening for bronchovesicular and vesicular sounds, and noting if I hear any crackles, wheezes, or rhonchi. Onto the anterior chest. Just going to again look at the skin and just observe her respirations. Make sure that they're not labored and she's not using her abdominal accessory muscles or any of the other accessory muscles. Also looking for any pulsations or heaves that are visible. Then I'm going to again palpate, noting any tenderness. And I'm going to feel for the apical impulse, just to feel if there's any thrill or heave. And there's not. So then I'm going to percuss. I'm going to again go side to side and just note that the cardiac border will sound dull as opposed to resonant like the rest of the lungs. Okay. And lastly, I'm going to auscultate in the front as well as the sides. Next, I'm going to listen to the heart sounds, and I'm going to auscultate those too. So we'll start with the aortic point, which is on the right side, second intercostal space. And I'm going to move over to the left second intercostal space at the pulmonic site. And I'm listening for a normal S1 and S2 sound. Then I'm going to move down to the left fourth intercostal space at the tricuspid point. And then down to the left fifth intercostal space at the midclavicular line for the mitral. Okay. And then if you'll lean forward just a little bit and listen at the left sternal border, as well as the apex, and I'm just listening to make sure I don't hear any murmurs or any abnormal heart sounds. Okay, and then if you'll lay on your left side, I'm going to listen for any diastolic sounds. Okay. Now we're going to move on to the abdominal assessment. I'm going to have you lift your shirt up to about here, and I'm just going to inspect the skin. Make sure that there's no notable scars, no lesions, and that the color is normal. I'm going to look at the abdominal contours, make sure that there's no obvious pulsations or movements coming from the abdominal region. Then we're going to auscultate. So I'm going to listen to all four quadrants. for bowel sounds, and I'm listening for their pitch as well as the frequency. Start at the right lower quadrant, move up to the right upper quadrant, the left upper quadrant, and the left lower quadrant. And then changing the diaphragm of my stethoscope to the bell, I'm going to listen to the aorta, the renal arteries, iliac arteries, and femoral arteries, and I'm just listening to make sure there's no bruit. Okay. We're going to percuss the abdomen, and the abdomen typically sounds tympanic. The liver's going to sound dull. So, I'm just going to find the liver margins, we're going to stop at the area of dullness that we find, and then around the fifth intercostal space is the other line. We want to palpate or percuss to feel that too. So, and that's usually between 6 and 12 centimeters. Also, when percussing for the spleen, it is a tympanic organ also. So we have the patient take a deep breath, and we're just gonna percuss. It's usually around the 6th to 10th rib that you'll find that. So that's there as well. Then we're going to do some light palpation and deep palpation, starting with light palpation. I'm just noting any tenderness or muscular resistance in the abdomen. Okay. And when I do deep palpation, I'm going to palpate for the liver border, the spleen, both kidneys, the aorta, and the femoral pulses. So I am going to typically feel the border of the liver, but it's not typical to be able to deeply palpate the spleen. Okay. I'm going to have you lift your head up just a little bit, and I'm going to observe the muscles of your abdomen too, and those look good. Okay. So with you laying there, I'm just going to take a look at your legs at first and just make sure that they have a good color, that there's no, I'm going to note the hair distribution there, look at the muscle mass, and I'm going to look for any signs of peripheral vascular disease. I'm going to also feel for the temperature of the lower extremities, check for any edema, and then also check the pedal pulses and the posterior tibial pulses, as well as the popliteal pulses. Okay, if you will sit on the side of the bed, we're going to check the Achilles tendon. So I'm going to hold your foot, I'm going to strike the tendon, and then she should plant or flex her foot. And then we'll also check the patellar tendon reflexes. So just relax your knees and leg completely. Okay. I'm going to have her dorsiflex her feet and then plantar flex her feet. So pull them back for me and then push them down. Okay, now that's good. And then if you'll stand up, I'm just going to have you walk over there and then walk back. And I'm checking for coordination, stability, smoothness of movement, and ataxia. And then if you'll touch your toes and just come up slightly, right to there, I'm just going to check the back, make sure there's no curvatures or signs of scoliosis, and that she's symmetrical and even on both sides. So that concludes the video. Thank you for watching.